Okay, this is my abdominal and musculoskeletal video. First, he will scan the room to make sure I do not have any notes. Okay, to begin this assessment, I would first check the patient's chart to see if there's any doctor's orders given. Then I'd provide privacy and wash my hands. And identify my patient with two identifiers. Can you tell me your name
Colt Tripp,
and your date of birth?
7/13/98.
Good. So I'm Morgan. I will be your nurse today. What brings you in today?
Just for a checkup.
Are you in any pain at all?
No.
Okay. So to begin, I'm just gonna ask you a few questions. All right?
Okay.
Okay. So do you have any problems urinating?
No.
Is there an odor to your urine?
No.
Does any burning?
No.
Okay. When was your last bowel movement?
This morning.
Was there any blood or mucus anytime?
No.
Okay. Was it liquidy?
No.
Okay. Are you on any medication?
No.
Okay. So now what I'm going to do is I'm going to listen to your bowel sounds, okay?
Okay.
I'm going to lift up your shirt. Okay, so when listening, I heard bowel sounds in all four quadrants, and if I didn't hear, I would listen for 5 minutes or until I heard one. So now what I'm going to do is I am going to percuss, okay? So tell me if you have any pain or tenderness. Did you have any pain?
No.
Okay, so when doing that, I noticed that it was tympanic and it was dull on the liver. So when looking at his stomach, it is normal temperature and it is symmetrical, and his umbilicus is midline with his body, and there is no masses, lesions, or anything like that. And his skin is appropriate for ethnicity. So now what I'm going to do is I'm going to just do light palpation, okay? So tell me if you have any pain. So with light palpation, I would go 1 to 2 inches underneath the skin. Any tenderness?
No.
Okay, so when doing that, I did not feel any bumps or anything unusual. So after doing that, I would do deep palpation, which is 3 to 4 inches underneath the skin. So now what I'm going to do is I'm going to listen to the aortic, iliac, and renal with the bell of my stethoscope. So in doing that, I did not hear any brutes. Okay, so now what I'm going to have you do is I'm going to have you push against my hands and do the same. So push. Good. And now push and push against me. Good. So when doing that, I did not notice it was symmetrical and there's no weakness. So now what I'm going to do is I'm going to do this to your foot. Good. So that was a normal finding that his foot did that. So now what I'm going to do is I'm going to have you sit up. And I'm going to have you squeeze my fingers. and push against me. And push this way. Good. So when doing that, I did not notice any weakness in his, and they were equal bilaterally. So now what I'm going to have you do is I'm going to have you stand up and walk there back. Good. So his gait is good. So now I'm going to have you, I'm going to have you do your range of motion. So roll your arms in like a circle. Good. And backwards. Good. So I had him do circumduction and there was no limited range of motion. So now what I'm going to have you do is I'm going to have you put your heel to your shin and slide it down to your foot. Good. And then put your hand out and put it to your nose. And then put it out. And then bring it to your nose and bring it back. Good. And then I'm going to have you stand with your arms by your side and with your eyes closed. Okay, so that showed me that cranial nerve number 8 was intact. So now I'm going to have you sit back down. And do you have any weakness in your muscles at all?
No.
Any times that you get dizzy?
No.
Okay. So that concludes my video.